You're on mute, Martin.
Because nobody else was speaking to me, so I stayed on mute.
That's you now. Are you happy to agree the minutes of the 18th of September?
Yeah.
Great, grand. Thank you very much. Okay, we'll move on to the minutes of the meeting of the 30th of October. Has everybody had a chance to read them? That was just a short agenda there. We were looking at the annual accounts. David's happy to agree. Martin?
Yeah.
Can you agree? Okay, that's brilliant. Great stuff. We'll move on now to the action points. I don't know who's going to take the action points. Is Jackie's not here? If you could please. Oh.
Action points update. The first two actions remain outstanding. The first action has got today's date on it. It hasn't been completed, but then it's something that we'll look at in the next couple of months with the chair to see how we can resolve that. The second one is the date of the end of March 2024, so we will endeavour to get that completed in time. Action reference 55 in relation to emerging strategies for GP services. We've marked that as complete. There was an update on the Tayside-wide primary care strategy, which was considered the IGB in November. So we have marked that as complete. We should note that the Tayside primary care strategy will come back to IGB in February for full approval, and that was discussed fully at that meeting last week. The final one, the RAG status of partnership improvement plan, there was mentioned that RAG wasn't the correct term for the way we were defining our statuses, so we will update that in time when that comes back to the next Audit Performance Committee meeting in March. That's all. Thank you.
Thank you very much. That leads us on to matters arising. Are there any matters arising in the room or online? Nope. Okay, thank you. That'll take us on to the performance section of the agenda. We'll move on to the financial position, and I'll hand over to Donna, please. Thank you.
Thank you, Chair, and good morning, everyone. This report provides the committee with the latest financial position and forecast based on expenditure and performance up to the 31st of October. The committee will recall that the IGB approved the use of reserves as part of its budget for this year, and in October it approved further use of reserves in order to support the Health and Social Care Partnership's winter plan. And the position being presented today is a £2.1 million overspend, and that's after the use of these reserves. If I can refer you to section 3.4 of the report, in which it provides high-level detail around what is driving that unplanned overspend. And the key areas are our older people services, our GP prescribing costs, the 2C practices and the out-of-hours service. And the report provides further explanation on these areas of spend, and it also highlights to the committee that financial recovery actions are being progressed to mitigate the cost pressure and reduce the overspend where possible. One area that I am keen to just take some time to highlight is the progress that's been made on the financial risk share for general medical services, and in this is what includes the 2C practices. As I've referred to 4.18 of the report, the risk share review is being progressed by the 3 IGB CFOs, and it is likely that the outcome of the overall review will result in a reduction in the financial risk to Perth and Kinross. And there is already an interim working arrangement in place which is reducing the general medical services pressure to Perth and Kinross IGB pending the outcome of the risk share review. So you will see in the table in section 3 of the report that there is a movement, an improved movement under the 2C practices share. The general medical services budget is complex and there are multiple pressures and variances within this budget. And it is due to that it is not logical to look at 2C risk sharing in isolation due to the interdependencies with other aspects of the general medical services. But what I would say is that this work will move us in a material way towards a more local GMS budget. It will improve the visibility of the GMS issues and increase local accountability and ownership. So feel positive in the level of movement that's been made, the direction of movement that's been made and the amount of work that's undertaken already. The work and the report is being finalised for presenting to chief officers, and we aim to bring an update to the March Audit and Performance Committee, confirming and detailing what is being proposed. And at the end of this introduction to the report, I'd be more than happy to take questions specifically on this area. Finance report updates the forecast reserves position. So that's in summary at section 6 of the report and in more detail at appendix 3. And should the final outturn be the £2.1 million overspend, then our reserves will reduce, our general reserves will reduce to 2.4 million. And that's around 1% of our net budget, which is below our policy. But due to the movement since our last finance report, this 1% balance is an improvement in the position advised to the IGB in October when it was presented and approved the winter plan. We have seen an improvement in the reserve level that would be remaining. As noted in section 7 of the report, it's important to note that financial risks do remain, and that if these are realised, they will deteriorate the position further. Also, this financial position is helping us to inform the budget planning for next year. And IGB members will be involved in the budget development sessions commencing this Friday. But it would be appropriate for me to raise at this point that due to the forecast financial position for this financial year and that early look at the budget for next year, the paper that you will be considering later on strategic risk recommends that the financial risk is increased to the highest level. So to conclude, the overall projection at this time is a £2.1 million overspend, but financial recovery actions are being progressed to mitigate this where possible, and reserves will be applied to bring the position into balance. And I'm happy to take any questions.
Thank you, Donna. Any questions? David?
I think everyone will be concerned on the pressure on reserves. If we don't curb the overspend and we run out of reserves, what are the consequences?
So the largest amount of financial risk is for next year. The financial recovery actions and the position that we're in at this stage in the financial year, I wouldn't say there would be a risk to our outturn for this financial year. Our risk level has been increased because of the position that we're in this financial year, and the fact that prescribing is still so volatile means that, in particular prescribing, there's obviously other reasons, but particularly prescribing being so volatile means that when we go into next financial year, we will have difficult decisions to make in order to balance. But to mitigate that risk, we will set a budget that does balance, that we'll have considered as an IGB, but it will be in the light of us not having reserve level that will mean that we can't make difficult decisions. We will have to make difficult decisions to balance the budget.
Matthew? Oh, I mean Martin. Sorry, I'm...
Thanks, Beth. Thanks for the report. I've got two. One you might be able to answer, you might not be able to answer, and that's about the underspend in the prisons. 0.817 and the duty staff vacancies. Is service still being provided in locum methodology or what's happening? That's the one that you may not be able to answer. And the second one is the operational responsibility for mental health. Rightly sits with NHS Tayside, but as an IGB we can direct. So does that impact on some budgets?
Thank you, Martin. I might bring Amanda Taylor in for the question regarding the prison, but in regards to the inpatient mental health, I think I've referred to it in the report, and I certainly know that Jackie referred to it, the Chief Officer referred to it in our IGB update. There is a financial recovery plan being undertaken by NHS Teesside that will be presented to the IGB or a relevant committee as soon as possible. So hopefully that will provide some reassurance that work is underway to try and reduce the cost pressure there. In regards to the prison, from what I know, and I'll bring Amanda in, is that although there are vacancies within the prison healthcare service, they are being partially, if not fully, mitigated, and Amanda will need to confirm that by the use of locum staffing where possible. I'll bring Amanda in.
Apologies, Dawn, I'm just hearing bits of that because my sound's not been working. So I'm thinking you're suggesting around the prison, around the agency and bank staff that's been used. So they are mitigating some of the actions in the operational management around that, using the tier 2 support that we're allowed to use at the moment.
But there'll be a cost involved in that.
Yes, there is a cost. But as in other areas, we're having to recruit. If recruitment's slow, we're having to use other options to support that gap in skill mix and safe staffing.
Thank you.
Okay.
Okay, thank you. Can I just ask about the adult services? We've got a projected underspend again. I suppose it's the same question about staffing. We're saying we've been having problem staffing, and we've been recruiting is progressing. Have we not been using agency in that, or how? Sorry, I thought it's okay. Can you come in?
Thank you, Beth. We have in areas been using agency. I'm trying to think of the exact adult services that would have included, other than, I don't think we have used agency under adult services, no, but the recruitment in providing this update, we did go do a check through all the services, and the recruitment is progressing well, and there weren't any risks to service being flagged to ourselves in that.
Appendix 2, we were looking at the lead partner services. Would it be possible in that, when we're looking at the cost, to put in, although I know it's the NHS responsible, but something in that page to show us the inpatient mental health, because that's part of the risk, is it? Do you know how we've got all the services that are shared services, if you like, in my head, and that inpatient services we're considering as a shared service with the other two IGBs. So I'm just wondering if there's some way we can look at that, because that's one of our risks, of that 5 million. So when we're looking at our totality of shared services, if you like, I think they're shared services, just that the lead agency is NHS Teesside rather than, I don't know, maybe I'm just...
Thank you. No, that's a really good point. I would say that there is an outstanding issue, as noted in the report, around the financial risk share of inpatient mental health. So it may not be appropriate for me to add it into this appendix, but I can find a way to make it far clearer in the summary of the report that the inpatient mental health position, so that you can see it in its totality. But perhaps until the financial risk share is resolved, we'll find another way of reporting.
Thank you for that. Any other questions?
Beth, I've got one question.
Okay, Martin?
I can't seem to type this thing. And it just went in my head what the question was like. No, it was about the winter plan. Have we got any update on how well or badly we're doing financially on that winter plan?
I could ask perhaps Amanda to come in so that you can get an update around the service being provided for under the winter plan, Martin. I would say financially, I wouldn't raise any concerns regarding where we expected to be.
Okay.
Thanks, Donna. Yeah, I think in terms of the winter plan, the two areas that we were focused on was around the medicine for the elderly beds in Tayward, and around the project that we call DDP. So both of them are functioning as expected. We do have some challenges around our delays, patients that are delayed in discharge, and we're continuing to work around that and keep the system flowing in terms of capacity and flow. So the extra capacity that we've created as part of the winter plan is definitely supporting that extended capacity and flow.
Is the delay in discharge because of packages, or are there any other factors like guardianship or what's the other one?
There's various factors,
Yeah.
and so there are a few guardianship cases, as we would expect, from the frail elderly population that we're looking after, but there's also a kind of balance between care at home and long-term care. So it's a multifactorial issues in terms of our delays. So we're very much focused on the pathways and getting them running as efficiently and smoothly as we can at the
Thank
moment.
you.
Okay, thank you.
Okay, no further questions?
Sorry, Beth, I just wanted to highlight Jackie Pepper, our Chief Officer, has just messaged to advise she's unable to join the link, but she is on live and listening, but she's unable to come in to speak. But she just wanted to confirm on that inpatient mental health discussion, there is a paper coming to the next meeting that will cover that part specifically for what you raised there, Martin.
Okay, thank you. So it's recommended that the Audit and Performance Committee notes the overall projected outturn for 23-24 based on financial performance to 31st of October 23. Notes the Chief Officer and Executive Management Team continue to work on financial recovery actions to mitigate cost pressures in the current year, and notes the financial risks as detailed in Section 6. So thank you. Okay, we'll move on now to the key strategic performance indicator report. Is that yourself, Chris?
Morning, Chair. Morning to Audit Performance Committee. It gives me pleasure to present to the committee the Q2 report and provides the committee with an update on performance against our most strategic of key indicators. Performance is good overall, with improvements seen in emergency admissions since the last quarter. Similarly, occupied bed days, that's the number of days that people in total have spent in hospital, is reduced by 2.62%. More detail on that is contained within the appendices. And this complements significant improvements that have been seen in delayed discharges, despite our most recent comment just a moment or two ago. If we look at the picture over a 12-month period up to the end of this quarter, delayed discharges have improved by almost 15%. So that includes all of the delays accumulated through the course of the last winter and then up to the second quarter of this year. So there have been some increases in delayed discharges most recently. They're not covered by this report, but will be part of our Q3 report. I thought that was, I should make that distinction. The committee will remember that we reported in March that readmissions were increasing and that this was driven by readmissions within 7 days of discharge. We have undertaken additional qualitative analysis of this, and we can see that readmissions for the 18 to 74 year group have risen by around 55% since before the pandemic. This increase equates to around 6.3 additional people being readmitted per week. So not to diminish the impact that that's had on a relatively small number of people. The context is provided there because the 55% sounds like a very large number, and it is in percentage terms. But in terms of the numbers of people who are affected by that, it's relatively small. For the 75 plus age group, that represents an addition of 2.7 people per week being readmitted. We acknowledge that there will be many factors which contribute to someone being readmitted, and that a qualitative analysis will be necessary to understand this in more detail, and we will now take that additional work forward. Turning to higher level qualitative performance measures in Table 1, it sets out performance achieved against national indicators 1 to 9. We can see the performance in this respect is very good, with 7 out of the 9 indicators being rated above 90%, and the remaining 2 being above 84 and 88%. The committee will know that we also use a care opinion to gather detailed experiences of people accessing our services, and Figure 1 provides an illustration of the overwhelmingly positive feedback that has been received by people who have accessed that route of feedback. For clarity, the diagram that's in Figure 1 that's set out there, the words and the size of the circles indicate how often that language has been used in respect to the feedback received, with green indicating positivity. Appendix 2 of this performance report contains a KPI report for the community mental health and wellbeing strategy, which continues our publication of performance reports for each one of our care groups as we move through our audit performance committees. This report demonstrates good performance overall, with around 3/4 of indicators on target, and this provides good evidence of the delivery of the desired outcomes from within this strategy. The IGB recently considered strategic progress against the community mental health and wellbeing strategy, and that was discussed at the IGB's meeting on the 29th of November. So this report provides additional context to that which was discussed at the IGB. I'm happy to pause there and take any questions.
Okay, any questions? Martin?
Yep, it's really good. It's a good report and it's easy to read. The fact of the matter that you're now associating people with percentages, I find very helpful, but because I'm a great believer in percentages can hide so many things when we know the number of people that actually involved is quite healthy. But what I would be asking is there a common theme why people are being readmitted? And that there needs to be a view of, are we putting people out too early? Are we putting them out with each support? Are we putting them out and just getting them back in again? But about even at 7 people coming back in or 9 people coming back in, there'd be a significant cost.
Thanks, Martin, for your question. It's been a significant challenge technically to get the data into a position that we've been able to present it today. It's a relatively simple question that was asked of us in March in respect to our understanding of readmissions, but it was as I say, it was a significant technical challenge involving really quite significantly large data sets to get it to the point we were able to present today. The next step in the investigation is the bit that you're referring to, is that qualitative analysis around what the actual reasons are. So we've done the bit of work to demonstrate that it's within 7 days, which is the biggest issue. We've done the bit to understand the proportion of issue over and under 75. We have, as part of that work, done some work in respect to locations of readmission. So we've got a much better understanding of that. This next step is that into that greater level of detail in terms of the individuals, their particular journeys, the reasons for readmission, and to pull out any thematic analysis that we can get from that. So I'm happy to report that back to the Audit Performance Committee when that work's complete.
Thank you.
Thank you. I was going to ask about the Community Mental Health and Wellbeing Strategic Delivery Plan. You're talking about the update and how far we are away from meeting the target. How do we judge that and who judges that? Because I know that was one of the issues with the last reporting, that the health board, for example, were reporting a more positive than the stakeholders. So how are these being agreed?
So I'll probably bring Chris Lamont in if he may have some further detail. But in terms of the structured approach that we take to our performance management reporting in respect to our care groups, is that when the strategy comes forward, or when it came forward initially, December 19, I think it was, we brought forward a performance management framework that set out the outcomes that we seek to achieve, the key performance indicators that we are going to measure our progress against, and within that, the targeted approach to whether we expect that trend to go up or down, the extent to which we expect it to go up or down. So that was a piece of work that we did at that time. We brought that forward for approval to the Integration Joint Board. I think on the specifics of whether the number should be 80% or 75 or 70 or whatever, that is a movable feast. I think it's about being realistic. It's about charting our progress in the right direction, but allowing a sufficient level of stretch that puts us in a position of pushing towards the delivery that we're looking for. As Chris reports out to the IGB on an annual basis in respect to updates, that there's an opportunity for members of the IGB to look for additional stretch in that respect. And from a reporting point of view, we would look to support Chris and his team.
Thank you. There's a festive Chris there. Would you like to come in, Chris?
Just on mute, Chris. Can't hear you.
Can you hear me?
There you are, yeah.
Right, there we go. I'm sorry, Beth, you'll need to repeat the question because the link's not good, as I've just proven. I was just wondering if you could just repeat it and then hopefully I can answer the question. Can you hear me?
Oh, Jinx. Sorry, I'm not performing very well in my role as chair this morning at all with this button.
That's
sorry.
okay.
It's key performance indicator report for the mental health, basically, and it's around the green, amber, red, and the scoring around the outcomes. And it was just, I'm aware that from one of the last reviews, there was a disparity between different parts of the organisation and how they assessed how well we were doing in the targets. And I was just wondering how we're assessing them and who's assessing them to see if we're getting a good balance.
Okay, right. So I'll keep this brief. So basically what we're trying to do is we're trying to marry up our own key performance indicators with what's happening nationally so that we've got a consistent barometer. I think Chris might have answered some of these questions anyway, but we are mindful that Angus are wanting to adopt what KPIs we've now developed, and Dundee had already got some KPIs in the system that they were wanting to keep because it was very specific and pertinent to Dundee, and I'm not sure how exactly they measure them. We measure them by pulling it from a variety of different sources. So obviously we pull it from a variety of patient satisfaction surveys and the care opinion. We pull it from Public Health Scotland data, and we also pull it directly from our own track care systems and information that we hold directly within our own services. The barometer that we use, i.e. the green, the RAG and the amber status, I have to be honest with you, it's not my favourite way of measuring, and I know that there's several other people probably feel the same way, but it's something that we have to use because it's what the government understands as well. And the 80% or above is usually matched up to what the new mental health standards are suggesting that we measure against as well. It's just so we can compare like for like against other organisations and other services. So I'm hoping that potentially answers your question.
Yeah, that's great. Thank you very much. The only other thing I was going to highlight from this report is now this sounds really bad, but I was glad to see some red in the care opinion feedback, and simply because it's a small bit of red, but it does show, I think there were some questions raised at a previous meeting that it couldn't be everything be so good. So I like the pre-agenda meeting, I commented I really liked this diagram, particularly the way it highlights the issues in the staff, for example. But it was good to see that areas of improvement, and they're all in a very similar area. When you look at the communication, the support, the explanations, the advice. So it's all around the same kind of things that we can target improving services. But I just wanted to highlight that because it was something that had come up before that couldn't possibly be as good as it seemed. But it is a realistic position where I get in some comments that are not 100% positive, which is good as a learning tool. So any other comments before we move on? Okay, so the recommendations are we are asked to note strategic performance in relation to the core suite of integration indicators and to note progress in the delivery of the outcomes defined within the community mental health and wellbeing STP. So we're happy with that, to note that. Okay, thank you very much. Right, we'll move on now to the governance and assurance. So the next one is a strategic risk management update. Phil, is it you that's taking that? Yep.
Thanks, Chair. So this report provides an update on progress in controlling the risks identified within the IJB's strategic risk register. Our executive management team routinely reviews IJB risks to make a collective and balanced assessment of the risk environment. This process of review includes consideration of operational risks to assess the extent to which they have a strategic impact. At the most recent review by the executive management team, there were a number of changes made to the scoring of some of our strategic risks, and I'll quickly take you through those changes. So SR01, our financial risk, has increased to 25 due to change in financial pressures, and we heard a little bit about that earlier this morning. Strategic risk 05, sustainable digital solutions, is the likelihood has increased to 3, giving a score of 12. And this now changes that from a yellow to an amber risk. SR06, viability of commission providers, the likelihood has reduced to 3, meaning a new score of 12, and this has changed from red to amber. SR09, leadership capacity, has been rescored to 8, with the likelihood of occurrence reducing. SR14, partnership premises risk, has been reduced from 5 to 4, and an overall score of 16. This does remain a significant risk, however. Table 1 in the report assists with more detail on justification for current scoring and covers the rationale for changing score or for maintaining the status quo, as the case may be. Our management of risk of the risk environment is supported by a risk management improvement plan. This is detailed in Appendix 3, and Table 3 in the main report provides an overview of additional improvement actions which have now been identified. Good progress has been made overall against our improvement actions. Of those that are read most relate to care at home delivery, which is a transformation project within our transformation programme, and that's that key project. As that progresses, will assist in the improvement of progress against those improvement actions. I'm happy to pause there and take any questions.
Thank you for that. Any questions or points in the room first? Nope.
Beth, I've got
Mark,
one.
yeah, I'm coming, Martin. Yeah, okay.
It's on, thanks for the report. See on SR06, the viability of commission providers. And when new legislation that's coming in about people coming in to this country, is that not going to impact on the capacity for care homes, and as such, could it not impact on the viability of some care homes? And should that be considered, or is it too early to consider it in this risk?
Thanks, Martin, for the question. Yeah, I think your last point there is right. Some of the announcements that have come in respect to I think you're referring to the salary threshold was announced just at the early part of last week. So that hasn't been factored into this report, just in respect to the timescales for getting the report to committee. They will, however, be considered in due course as additional reports come forward.
Thank you.
Kenny, do you want to come in?
Yeah, thanks, Chair. Yeah, as Chris said, there have been recent announcements from the Westminster government. Social carers are exempt from the increased salary threshold. However, they aren't exempt for the restriction in the number of dependents that can come across as well. So I think the short answer is we're not too sure what the impact will be yet. Increasing numbers of our care providers in Perth and Kinross are recruiting from overseas. But like I say, social carers aren't included in the increased annual salary. But like I say, the restriction in the number of dependents that can come in may have an impact, but we'll obviously monitor and mitigate as best we can.
Thank you, Kenny. Are you happy with that, Martin?
Yeah, I understood about the social care not being included in it, but I think it's a dependence one that I'm more involved in thinking that will have an impact.
Yeah, thanks, Martin. Dave Henderson, you've got a comment?
Thanks. Just following up from what Kenny was saying on the position of the watch and brief, we had the care at home forum last week where Shona McLean comes along, the service manager with the external providers, and that was discussed. It was just out that day or the day before the announcement from the UK government. So it is a watch and brief at the moment, but it does affect care homes, care at home and other providers as well.
Thank you, Dave. Thank you. Thank you for highlighting. I think we need to keep an eye on that then. Any other points, questions? Seems quite comprehensive to me. Nothing's jumping out that I'm concerned about. So it's a recommendation that the Audit and Performance Committee is asked to approve the IGB Strategic Risk Register and Strategic Risk Improvement Plan. Are we happy to approve? Okay. Thank you very much. Moving on then to the internal audit progress report. Jackie, I'll hand over to you.
Thank you, Chair. This report provides an update on the progress since the last meeting of the Audit and Performance Committee, when the internal audit plan for 2023-24 was approved. Fieldwork for the assignment from the previous year has continued, and I'm anticipating that some draft outcomes from that should be shared before the end of this year, with the report coming forward to the next meeting of the Audit and Performance Committee. I've been engaging with some of the services regarding scoping and timings for the work to be undertaken from the 2023-24 internal audit plan, and that will continue into the next few months. I'm happy to take any questions.
Okay, the one thing that probably jumps out is the discussion we've just had for both the sustainability of the commissioned services and the workforce. So it'll be interesting. I'm assuming that that'll be part of the audit.
Yeah, the scopes have yet to be finalised, but we've had the discussions, and there will be an awful lot that comes into the mix for those audits.
Okay, any other comments, thoughts, questions for Jackie? David, you?
I'm happy with the report. Thank you. Thank you, Jackie.
Any more points for this? Okay. Recommendation is that we are to note the progress made in the delivery of the plans for 22-23 and the 23-24. Okay. We'll move on now to clinical care governance. I've got Kenny in the room. Welcome, Kenny. I'll hand over to you for the audit. the Clinical and Care Governance Assurance Report. Thank you.
Thank you, Chair. And again, the purpose of this report is to provide assurance to the Perth and Kinross Health and Social Care Partnerships Audit and Performance Committee in respect to clinical care and professional governance arrangements in place for delegated and lead partner services managed by the Perth and Kinross Health and Social Care Partnership. Now, this report contains the report presented to the Perth and Kinross Council Scrutiny and Performance Committee on the 13th of September 2023. And this report covered the period between the 1st of March to the 30th of June 2023. And the report is virtually identical to the report presented to NHS Tayside Care Governance Committee on the 3rd of August 2023, which was shared with the last Audit and Performance Committee. And as with the report to the Care Governance Committee, the report to the Scrutiny and Performance Committee, a level of substantial assurance was proposed and accepted. This report also contains the exception report presented to NHS Tayside Care Governance Committee on the 5th of October 2023, highlighting exceptions between June and October 2023. And the exception report highlighted risks relating to decontamination equipment at Broxden Dental Centre and the outstanding Home Office controlled drug licence at the Bella Community Custody Unit. I just want to say that that licence has now been approved and mitigating actions are controlling the risk relating to the dental service centre. So the Audit and Performance Committee is asked to note the responsibilities of the IJB in respect to clinical care and professional governance, note the arrangements in place for providing the IJB with assurance that effective and robust systems of clinical care and professional governance are in place. Note the Perth and Kinross Council Scrutiny Performance Committee received a full report regarding clinical and care governance, which is in Appendix 1 on the 13th of September, and it was agreed that it provided substantial assurance. Note the exception report presented to NHS Tayside Care Governance Committee on the 5th of October 2023, and note that the Chief Officer confirms the effectiveness of the above systems in place in the IJB's partner organisations.
Thank you, Kenny. I'm quite familiar with these reports from both this committee and care governance. Is there anybody got anything they want to highlight or anything they want to raise or questions? Oh, this is a good report then, eh? You can get back upstairs. Well, thank you. I think what I would comment on is that, oh, Martin, is that your hand up?
Yeah, thanks, Kenny. It's a good report. I'm just on item 4.1. There is evidence of affected information systems and relevant professional and service networks. Where does that evidence lie?
Sorry, Martin, I'm struggling to see the part of the report you're talking about. Is this in the main report? Is it in?
And item situation under number 4.1. Page 80 of 138. Sorry, that's the wrong one. Is it that? It's page 80 of 138.
Yeah, sorry, I've got you. Sorry, Martin, could you repeat the question, please?
Where does that evidence lie?
Sorry, for what? For the arrangements that are in place to provide assurance?
No, there is evidence of effective information systems that are relevant to professionals and service user network or groups feed into the agreed. Where is that evidence?
I think that you find that evidence in the Care and Professional Governance Forum minutes. The Care and Professional Governance Forum, as you know, it meets regularly and it gathers and assesses evidence and information from a range of other meetings, such as the care governance meetings in the localities, the professional care governance meetings, etc., information from complaints. That's all fed into the Care and Professional Governance Forum, and they then ensure from that information that appropriate standards are being met, or identify any actions that are required, and then put that back to the services and localities. So like I say, that evidence would be shown in the minutes of the Care and Professional Governance Forum.
Thanks for that. Look, Miss. Thank you.
Yeah, I would confirm, Martin, there's a lot of information that comes through care governance, similar to P&R, but we look at it from an impact on health and individuals rather than just the stats themselves. So there is quite a body of evidence there for us to look at, and there are a series of structures of committees that feed in and professional groupings. So
Yeah.
If you need any more, I can give you a shout.
No, happy with that answer, just showing you where to look.
Okay, that's great, thanks. Sandy, you've got a question?
Yes, thank you, Chair. Is there any update on the MAT standards 6 to 10 yet? There was expected to be an update by October on the quality criteria, the acceptance criteria for 6 to 10.
Yes, I mean that's happened since this report was written. But yes, we now have further evidence on the what's required to meet standards 6 to 10. So we're currently working on that.
Right, excellent. Thank you.
Okay. No more points, no more questions. I'll read the recommendations out again just for the purpose of the minutes, so you'll be bored hearing this. So the committee is asked to note the responsibilities of Pre-K Integration Joint Board in respect of clinical care and professional governance and those of the IGB's partners. Note the arrangements in place for providing the IGB with assurance that effective and robust systems of clinical care and professional governance are in place. Note that P&K Council's Scrutiny and Performance Committee received a full report regarding clinical and care governance on the 13th of September, where it was agreed with providing substantial assurance. And note the exception report presented to NHS Tayside's Care Governance Committee on the 5th of October 23. And note that the Chief Officer confirms the effectiveness of the above systems in place in the IGB's partner organisations. We're happy to agree. Okay, thank you. Right, moving on. Just for information, we've got the Audit and Performance Committee work plan. Any comments around that? And then we've got the attendance record, sorry.
Yeah, it looks like a good plan for the rest of the year or next year.
Thank you. And then we've got the record of attendance from the 1st of April to 31st of March. Well, up to, not including. If everybody's happy to look at their own position, if there's anything, any disparity, if we could let us know. And that brings us to the end of the meeting, which is not bad considering we started a wee bit late. So thank you very much for your attendance.